Did you know that according to the Center for Disease Control and Prevention, someone has a heart attack every 43 seconds in the United States? Did you know that every minute someone in the United States dies from a heart disease-related event? Unfortunately, in today's world, heart attacks are common. In fact, most people, including myself, either know someone who has suffered from or even died from a heart attack. Due to these alarming statistics, it is extremely important for everyone to know what to do in case they encounter someone who is having a heart attack. Whenever I was training to become a lifeguard last April, I became CPR certified. According to the medical dictionary, CPR is the manual application of chest compressions and ventilations to patients in cardiac arrest, done in an effort to maintain viability until advanced help arrives. When performed correctly, CPR greatly increases a person's chance of survival. Today, I'm going to explain the proper steps to take if you encounter someone who you suspect is having a heart attack. These steps include, first, assessing the scene and checking to see if the victim is conscious and has vital signs. Second, giving chest compressions to the victim. And third, administering breaths to the victim. If you come upon a victim who you suspect is having a heart attack, the first step you should take is to assess the scene and check the victim for consciousness and vital signs. Heart attacks can unexpectedly happen anywhere, so it is pertinent that you make sure your victim's surroundings are safe. When assessing the scene, check for things that could potentially be harmful to you or to the victim. For example, if the victim is on the side of the road, move the victim to a safe place before performing CPR. Once you have assessed the scene, check to see if the victim is responsive. You can do this by tapping and shouting. If the victim is unconscious and is not breathing and does not have a pulse, immediately call 911. Once 911 has been called, you may begin the second step. The second step to take is to begin CPR by giving chest compressions to the victim. When giving chest compressions, it is important to know if the victim is an infant, a child, or an adult. In this case, an infant is classified as being less than a year old, a child is classified as someone between the ages of 1 and reaching puberty, and an adult is classified as someone who has gone through or is going through puberty. If the victim is an infant, place your pointer and middle finger just below the nipple line in the middle of the infant's chest and press down 1.5 inches 15 times. If the victim is a child, place the heel of your dominant hand on the lower half of the breastbone while placing your other hand on top of the dominant hand and press down about 2 inches 30 times. If the victim is an adult, compress the victim's chest just like the child except press down a little over 2 inches. It is important to remember to compress the victim's chest at a rate of at least 100 compressions a minute. After you have given the correct amount of compressions to your victim, depending on their age, you may begin the third step. The third and final step to take after performing the compression part of CPR is to administer the breathing part of CPR. This step works in much the same way as blowing up a balloon. Just like in blowing up a balloon, you must blow just enough air into the victim's lungs to fill them up. Before giving breaths to the victim, however, you must first open the victim's airway. In order to open the airway, gently place one hand on the victim's forehead and use the other hand to tilt the chin upward. Once the airway has been opened, give the victim 2 breaths. You can use mouth-to-mouth, or you can use a CPR mask like I have here. I got mine when I was trained to become a lifeguard, but you can also buy them on the AmericanRedCross.com. It is important to remember to only breathe until you see the chest rise, especially when dealing with infants. Infants' lungs are much more fragile than adults, and if you put too much air into them, you could cause them to burst. After administering 2 breaths to the victim, repeat steps 2 and 3. Do not stop. Continue repeating steps 2 and 3 until you are relieved, the victim regains consciousness, or until EMT arrives. In conclusion, there's a 3-step process you should follow if you encounter someone who you suspect is having a heart attack. These steps are assessing the scene and checking the victim for consciousness and vital signs, giving chest compressions to the victim, and administering breaths to the victim. According to CPR facts and stats, sadly, 70% of Americans may feel helpless to act during a cardiac emergency because they either do not know how to administer CPR or their training has significantly lapsed. Cardiopulmonary resuscitation, or CPR, greatly increases a person's odds of surviving a heart attack. Due to this, I strongly believe that more people should become aware of and hone in on the skills of CPR. You never know whose life you could save. Thanks.